Good evening, everyone. This is Corinthia Benison, founder of Renaissance Center of Mastery on the Black USA News Network. It is Wednesday at 7 p.m. And I am happy to be here talking about mental health with a dedicated professional in the New York community who's been providing services for over 30 years, Gina McKinney. Thank you for joining me.
I'm happy to be here. Thank you for having me.
Thank you. So today's topic, we're just going to, get right into it and just kind of talk about mental health. But, I want, you to share with everyone just your experience, kind of your background and, you're an expert in the field. So, we're here to listen and learn.
Yes, I think being an expert comes with just years of experience. So I've been in the field for, like you said, over 30 years. I started out not actually in the field of social work. I kind of gravitated towards social work after a unique experience I had when I learned that, some things are designed, like welfare centers are designed to dissuade people from coming in for services. And that made me think about, what I wanted to do. I wanted to be a social worker. I wanted to educate. I wanted to advocate. I wanted to empower people to be able to make change. I really felt like that is where I was best suited. So, of course, I got a bachelor's and a master's in social work, and with the intent of going straight into private practice right after I obtained my master's degree. And I did some direct practice work. I was a preventive social worker for a couple of years, working with foster care, and that was really great work. And decided that I was going, at that moment, I started working for an independent organization where I was their therapy consultant. And it was at that time that I was really moving towards private practice when I learned by happenstance that many of my counterparts, especially the school that I went to, I was probably one of two people of color in my graduating class of 300, which I thought was really odd. I thought I would see more representation of myself of people of color in a master's program. And I realized that a lot of people, our white counterparts were running programs, many of them. And I decided that, we needed to have more equity, if you will, more representation of people of color at the seat of leading programs as well, alongside our white counterparts, so that it would be more mutually inclusive and that we'd be able to really bring change, right? So I did that by happenstance, but I was kind of, riding a bike and building at the same time because I didn't want to do management. So I had to learn management as I went along and decided that, of course, I wanted to be able to be a role model and train other people of color to lead programs. So I wound up running HIV programs and other, such as asthma, women's program, for probably the next 20 years of my life. Extremely rewarding work. I did do private practice on the side, if you will, to keep my skills active. But now I decided, and especially in 2020, I had the opportunity to work with the Boris Lawrence Henson Foundation, which is Taraji P. Henson's foundation. And it was at that time I relaunched my private practice. So it's my intent to have a full-blown private practice and move out of my current position. And what I did is I moved into more into health equity and healthcare transformation in my new role. And I've been working on the cusp of that, of really bringing together services. I worked with Disrupt for a while. And right now I am working again still with grants and healthcare transformation.
Wow, that's a whole lot. And thank you, for sharing all that. And I really, what we really want to talk about equity. Like that is such an important word. And I just wanted to ask you as a provider, what does equity, look like? And one thing that stood out was you taking that role on in leadership and being comfortable or finding the comfort and confidence in that, being the only woman of color. And that's been that is a challenging role and, even in different spaces to do. especially in mental health, whether it's across any discipline. It's really hard to break a barrier, be a woman of color, and, have a voice and be a trailblazer. And so could you kind of share, because you kind of did equity, right? You
Yes.
worked that percentage, that small percentage, that space.
Correct.
What was that like for you?
Today, I would say there's greater representation of women, and we do need more men, period, in the field of behavioral sciences, which is social work and the like. But it was challenging, but at the same time, it was very rewarding. And I just had this mindset that it's going to change. We're going to make a difference by adding to what already existed. We're going to enhance it. I thought that, there was a lot that my white counterparts brought to the field, but I just thought that we were doing a direct practice, and that we needed to lead, that our lens from the leadership from the macro level was very different than the direct practice that we did, and that we needed to understand what it really meant to effectuate change from a policy level, from a state level, a federal level. And many times that's what we didn't understand. That's why it was so important to me, because I saw the connection of really making change from that level as it trickles down to the direct service level, and why programs exist, why they exist in the format, what's driving it, what's the data, the stats behind it. And that's what was just that was such delicious work. It was just like, look, here's the evidence of what's happening in our community. And this is how we begin to address it. This is how we begin to peel back the onion to really, bring change to what's happening to our communities. And that, yes, we can be uniquely designed to work with it if we have the correct training. Right. And that was what was very key for me. I wanted to be very well trained. I wanted to make sure I mastered what I understood in my field. And because it was really important that I applied it with fidelity, right? So that it could be replicated and duplicated, and that folks could be able to model it so that you saw a change. It was very clear to me early on, even as a social worker, that folks are supposed to change, right? Even if they don't change the behavior, they recognize why, right? Mm-hmm. It wasn't just, let me help, let me give back. That was really never my mantra. It's part of innately who I am, but it was really about helping people to understand that change is possible, that mm-hmm. change is, that you're capable of it, and you can really measure it if you are looking for it. So I was always on the cusp of wanting to see outcomes. So really developing and leading programs that showed and displayed outcomes and change. HIV was very, HIV services absolutely did that from day one, from the Boston model on, and from in Africa, when they really showed where you partner with the patient and you're patient with them, you walk with them, you support them in their daily activities and their social determinants of health, how they were able to achieve healthcare outcomes and reductions in HIV, their viral load reductions, like they can get to the doctor, which was miles away, because their patient navigator would walk with them. That's healthcare equity. That's transformation. That's transformative, right? And that is really about the social determinants of health. And it's really, do we do that here, right? Mm-hmm. Why is that so, and how important it is to do that work here? And as a woman of color, it's really important to model that, to understand that it really is about looking for the outcome, not just about applying the service, but making sure that what you're applying is, bringing about change. That's what I thought was very different among people of color, clinicians of color. I think there are things that we just thought it happened organically, and it doesn't. We really need to apply it in a way that's very meaningful. So coming through the ranks, I was just really eager to see that work evolve. I was so confident. So I believed in it so much that I knew it was just a matter of time before people saw it. So I was totally humbly, but totally confident that over time people would see it. So I didn't care about what was happening around me. I didn't care about folks who didn't agree, folks who, thought that, I didn't know what I was talking about. I just thought that after a while that folks would, begin to understand how this works. And one thing that I did understand, that the responsibility of change belongs with all of us, not just with one group or the other group, but everyone in the continuum has an opportunity to operate at their highest level. Right. And that change is possible for everyone. And there's always opportunity to grow, learn, and gain new skill. You never level off.
Yeah.
Not mental health, at least.
Yeah. Yeah. And, that resonates so deeply with me just as a business owner, as a new social entrepreneur, and, trying to figure out, okay, why? And that's a huge question in social work. Okay, why isn't, this service available? Is this systematic? Is this, more of just social stigma with the population? And it's like a twofold. We do have, systematic stigma where, there is an allocation of resources, and where there are underserved communities like Harlem, and that we still are kind of having to address the stigma so that it kind of, I would say, just not, I don't know, it intersects, and you kind of want to, like, again, measure that impact. And, that's another key tool with programs and sustainability. You really have to show that there's, you have to measure your impact. You have to have the structures in place in your business, and great, whether it's your EHR, whether it's, how you report what you're reporting, you have to kind of know what you're looking for in measuring, positive impact in the community. And so the approach, with just having RCM and putting that out there and wanting to give that back to the community is very, it's been very challenging. And I'm learning so much as well with the equity piece of, how to get to grants, how do I find missions that are aligned through foundations, and understanding where the money flows from. Like the federal government gives it to the National Institution of Health, and it goes, so you kind of have to really learn the business side of it so you can get, the funding, so you can be the change and implement it. And that is a process. That's something that doesn't happen overnight. It's a lot of relationship building. And you're right, it's everyone being empathetic and really wanting to do the work to really help, the youth that we're, in particular that we're targeting, and people in general. Everyone should have the right to be well.
Yes. That's equity.
That's equity. And so everything that you're saying just really resonates with where we're at in society. I think now the normalization of mental health, having more comfortable conversations, people will be more aware about recognizing problems within themselves or within their household, and having conversations from a parental perspective, or even a child being comfortable to express, things that are going on with them. So yes, I think, equity is something that we have to really continue to push for and advocate for, especially, on the political side too, but just even people taking up the responsibility and wanting to, provide services like yourself. Social work is such a growing field. And, that's where, like, I feel like it is the meat and potatoes where, you really are affecting the social determinants. You're like right there trying to steer, people on the right path and get them, to be productive, to be healthy. And so that one-on-one work, and even for the individual and families, I think that's another key piece of, healing, really healing households, just not focusing on that individual, getting the family involved as well.
Absolutely. Very key, what you're saying is, and you have to think about mental health as a business, but in terms of keeping it thriving, right? Because the idea is that we want people not just to survive day to day, but to thrive. A very different approach to living, right?
Yes.
And, mainly people of color, there is a stigma that's associated with mental health. It's because of the stories and narratives that we have that have been handed down about what mental health is. Now, mental health in itself has a certain stigma associated with it, but it's more acceptable in other communities than it is in the Black community. And it really is associated with you being weak and you having functional impairments that you somehow cannot figure out on your own, or that church does not heal. Now, the challenge that I often say to folks is, but think about life in itself, right? Think about what it takes to live life day to day, right? So mental health is really about your values and the alignment of your values, and that you're living a life that is not misaligned with your values, right? And that your values are sound. Your values are things that help you to grow, right? That they don't hurt you, they don't hurt others. It's not that we don't suffer from feelings. We all share the same or experience values in the same way, but we typically have 5 to 6 core values that really govern the way we think and operate. So based on those values that we have, what are our coping strategies? What are our coping? Did we ever develop them? Did we ever understand them? How did we learn them? Did we learn them from our parent? Was our parents' coping styles something that was effective? How much trauma did we endure? How much vicarious trauma did we endure? And one thing with people of color is that we just learn how to cope and grind through things, period. If you ask someone, how are you doing? They'll say, especially if I'm asking a client, how are you doing today? And they're like, oh, I'm fine. Things are going okay. And I was like, really? So how was your day at work? Was there any kind of interaction that you had that didn't sit well with you? That's when a person may say, you know what, I did have an issue. Why? Because the conditioning is that if it's not something catastrophic, there's no need to really talk about it. Otherwise you're just, blowing off steam, or, you're just airing out because you just need to decompress. So I just need to vent. But venting is really about the stressors that you're dealing with that impact your ability to cope effectively. And that can become an impairment in your functioning. And it just chips away at it. It's not, we talk about mental health like we go all the way to the severest end, like that's where it starts. It doesn't start there. Yeah. It's a process that we begin to break down our normal coping mechanisms, because you will have stress in life. There's normal stress. There are feelings of depression. You'll feel sad. Depression is really after 2 weeks of being sad and consistent, persistent sadness, that's when you progress to depression. So having these expressions and feelings in life, you will have them. You will face them. You will be challenged by them. You will grieve. You will lose people. Things will happen. You'll become disappointed. And mind you, disappointment is the thing that causes pain. Everything else is a reaction from disappointment. So anger, everything else. And the way that people define people of color is that we're either angry, or we're sad, or we're happy. There's nothing in between. Many times we are indignant about something, but we express it in a way where people just define it as anger. So there are many times we just don't want to take the opportunity to be honest and open with providers. We don't want our community to judge us. It's very important that we have the affirmation of our community or of our loved ones. And if we demonstrate like we want to speak to someone, it signals to them that maybe something's going on, when in actuality, it is the healthiest thing you can do. Yeah. It really helps to reset. And that's in my practice. I have different programs where I have reset and realign, where 6 sessions, you talk about the key thing that's like challenging you, that's going on in your life, and you're able to like reset your mindset, your spirit, your energy, so that you can continue on. And that's really good mental health. It's no different than your physical health, your spiritual health, and your environmental health, right? It's really about making sure that you're equipped, that you're healthy, right? And that is what mental health treatment can do and can provide. And it can happen in many different ways, in groups. It can happen in a collective community. It can happen formally, like one-on-one. And there's some advancement with healthcare where they have the collaborative care model, where they are building in behavioral health in the primary care setting, where if you take the PHQ-9 or PH or audits, which looks at anxiety and depression, if you score more a 10 or above, you have the opportunity to sit with a social worker for about 6 to 10 sessions to reduce that number. So it really looks at what's going on in your life today that's causing the stress. So we can talk about it. We can come up with a strategy that helps you to cope. So it's really about strengthening and in unlocking the natural strength people have in them. Sometimes people don't know they have the ability to do things. And sometimes their resources, internal resources, break down. Sometimes they're disconnected from their higher power, right? Mm-hmm. Sometimes the trauma is in church and in their higher power. Sometimes the trauma is in the community. It's in the family. So then how else do you find that support, but to seek it outside as well? So it's really about rethinking how mental health works, rethinking about the benefits of it is really what the community needs to do. And that conversation needs to continue always. We need to really change our language around it. It is a healthy opportunity for you to do some self-evaluation, self-love, self-compassion, because one thing is that we cannot have, we can lack compassion for ourselves, right? The ego constantly is telling us A, B, C, or D. Sometimes I call it the committee because it sounds like it's more than one. And it'll tell us that we're not this, we're not that, don't talk to this one will say that, because the ego really wants to protect ourselves from greater harm, but it also limits ourselves. It helps us to have limit-setting beliefs. Mm-hmm. And that is where going and speaking to someone professional helps for you to unpack that and to begin to understand, no, it's really about the way you're seeing things. Here's other opportunities, and begin to source where these feelings came from, the origin of, and how your value is attached to it. Yeah. Right. Yep. And that is where, if we really begin to continually change that language, we will see improvements in health, not just for adults, but for children, for young adults, because they in particular would benefit key from any kind of therapeutic intervention. And it's in a lot, people think it's long-term. It can be short-term, like short-term, meaningful work that just really pushes people to and help them to unlock and understand, have new epiphanies about life and about what's in their reach, right? Yes. Really helps, because there's a lot of internal suffering. And that is what needs to change, right? That's really what needs to change. And like I said, we're all part of it. We all need to do our part. Today, I know that at least if a person of color goes to a doctor, for instance, right? Providers that are not of color, somewhere around 23%, they will direct the conversation as opposed to having the conversation be more mutually interactive, right? They will, and they will be less likely to hear what the patient wants or the client wants than another patient of a different background, a non-person, maybe a white counterpart of someone who's not a person of color. And this is because there is there is implicit bias, there is institutional racism where things are just set up in a particular way, and people continually, reinforce the same behavior and the same mindset. So what happens to the patient, what people don't recognize, is that sometimes patients become less apt to communicate. They just accept what they're told. And they won't talk about what's really going on because they're embarrassed or they don't believe that they'll be heard. That's inequity, because you have to be able to create an opportunity for people to be open and honest about what's going on with them so that they can get the right healthcare, so they can get a healthcare that meets their needs, right? That's equity. So you may have to reach a little bit more, have a different conversation to help your patients of color be able to communicate more effectively and feel safe in your setting, to be able to disclose what's really going on in their lives, which is different than from other patients who go into care.
Yeah. And, you're touching on cultural competency. I think that
Yes.
is, a huge issue in the healthcare space. I also, just having a background in healthcare, and we talk about the managed Medicaid population. And, from my experience, you're kind of treated as a second class patient, sometimes from a patient perspective. And even, kind of being honest about where clinics are located in actual facilities. Having to always tell a patient, for a clinic, you're in the basement, you're on the lower level, or just like even going to certain areas, it's not as updated or as nice as a private practice. And so, those are like real life disparities that people see from a patient experience. And even hearing patients, understand, their insurance and their limits with their insurance, with access to. And a lot of times there are, I could sense the frustration sometimes when a patient can't pick who they would want to see, or they read a bio of a provider and that provider doesn't part with that insurance, but they're really a good provider and feel like, that they're missing out on a care that they would prefer, So I think that is another piece from a client perspective and just from society perspective too, that we can work to be better at.
Yes.
And having the clinic, I think is still is a healthcare stigma too. A clinic, is like not kind of just not the same, I would say, as, the private practice standard. Do you agree or kind of have
No, I agree. I agree. It's not that you can design a clinic to feel like a private practice, but here's the deal. What happens in clinics is that because the cost of Medicaid and Medicare is just lower than the commercial insurance, so the reimbursement is lower, you have more patients, you book more patients, right? And in private practice, they will have appointment slots and they're really, pretty much rigid about, okay, you need to be on time or, if you're outside of 15 minutes, you can't, have to reschedule your appointment. But because they are reimbursed at higher rates, the loss of that particular patient and rescheduling is not as impactful, right? But in the Medicaid, where you have the majority of patients who insurance is Medicaid or Medicare managed Medicaid. The challenge is, you come in, just see them. So although they have appointment slots, they see first come, first serve. So people, a lot of patients figure out that, okay, well, I need to get out because I have other things to do. So I'm going to go early, but my appointment's at 11, but I'm going to arrive at 8. So the person who arrives for their 8 o'clock appointment, if they arrive at 8:05, they're going to be sitting for a while. So it's the structure and it's the way they set up the system that also impacts why the system works the way that it does, why it's not a pleasing and inviting kind of system. It really has to be a transformation, and we're going to try, together and really invite patients to be part of it. Like we're going to try and we want to improve this service for you. And this is a way that we think we can do it. And it's really important that you stick to your appointment schedule as close as possible. And, we're going to change. There's been, there's a number of things like the Medicaid waiver program. Really, there's been efforts, there's been money, Center for Medicaid Services has poured millions, billions of dollars, into trying to transform the system, primarily to reduce avoidable ED visits and inpatient care, because by 25%, that's what the governor wanted. And they did achieve that. But did they really achieve the goal of addressing the social determinants of health in an effective way? Did they really transform healthcare? Right. So the idea, it was supposed to be a triple aim, it's supposed to be high quality in the area that you needed it, in the space you needed, meaning that you're not going to emergency room for care, you're going to your primary care provider. Hence what you're talking about, meaning that, they won't go because it's not a pleasant experience to go to my clinic. And that is at a reduced cost. so that the healthcare system doesn't fail, bleed, or close, right?
Yeah.
So there is a lot of effort and money around it, but it's really about how effective are we really implementing, and are we implementing the correct services? I think we have touched upon it. I think we have made some strides, but I do believe it's at a deeper level. I think it requires greater analysis. I think it's beyond just the thought of it. Like, how do you do this? Is right. How is the true outcome going to occur? Right. And is everyone on board? Right. Because I led, a disparate program. And is it really going to achieve? And some of the frustration I had with leading a disparate program is that it really did not get to the core of what was to occur, which was transformation in the system and transformation with patients. We did have strides. People did do better. They did reduce avoidable ED visits and inpatient stay, but the culture of the system stayed the same, right? And it became a reliance on the staff that was hired to deliver, like, care coordination services, what typically happens is like, let the social worker do it or let the care coordinator do it. But the transformation has to occur through the full spectrum. It's interdisciplinary. It is the provider. It is the nurse. It is the front desk. It is security. It's everyone that's involved.
From the top
it's
to the
everyone.
bottom.
Yes, everyone has to decide that we are going to transform together, that this is what it looks like. This is your role. This is your role. This is your role. This is what you're going to do. So from the time the patient walks through the door, security is like, good evening. How can I help you? Here we are. We're happy to, have you here. What assistance do you need? If they see someone coming in with a cane, they get a wheelchair. They ask, how can I assist you? Can I walk you in, or do you need a wheelchair? What is it that you need? Where do you sit? It's really crowded. Let me get you somewhere else. Or really staggering visits so that it's not overcrowded, right? That it's appealing aesthetically, and that people see themselves represented, in pictures and in pamphlets, right? And in language. And it's that it's cross-cultural. It includes, the transgender, gay, lesbian community, that it incorporates everyone, so people feel included. That is the one problem I had when I worked with HIV services, because I was committed to having it being treated as a primary care condition. I just as a chronic disease. I really wanted to depart from having a dedicated HIV clinic. Like, it's not necessary, right? Or if you're going to treat it, then treat it in ID, but you don't have to treat it as a separate clinic anymore, because it's really about treating people and helping them to feel like they are connected to something, and being mindful that people just because they don't have, large bank accounts or, resources, or live in neighborhoods that, that are more economically impacted in a negative way, doesn't mean that they should sit for long periods of time, that you should rush through their services. And the healthcare system today is challenging as it is in clinics, because they are really, it's set up so that you don't deal with multiple complaints. You just deal with the primary complaint, or you deal with the annual follow-up. So if a patient, has a cough and a headache or stomach, they'll deal with one or the other and bring them back, right? So if they have something wrong with some other part of their system, their biological system, they'll bring them back, instead of saying, all right, let's talk about what's going on. Also, it's very time limited. So it's crunch time. They see folks in 10 minutes. How much can you really do? And give people the opportunity to talk about, okay, well, I do have a pain, and sometimes I feel like this, and sometimes I feel like that. What I've seen over time, because I've redesigned clinics. When I worked in HIV, there were times where the residents just weren't treating patients well. They weren't treating them well at all. And I decided that it was going to end. And this was what was very challenging for a woman of color, because one, I was in a male dominated environment. That was one. And then I was a woman of color too. So when I pushed for a provider to be removed from the service because I thought he was ineffective with patients that were living with HIV, I had a tremendous amount of pushback. And it was like, who are you to say to us that this person should leave? And I said, the stats say that, not me. It is the feedback from the patients and the stats in terms of their health outcomes that state that. Third, it's his feedback. He is stating his uncomfortability. So why are you having him there? And the response at the time was, well, he was our professor in our country. And I'm like, okay. So you have to be willing to take on those issues, but you have to handle them gingerly because you want the right outcome. So not everything is I'm going to fight rah rah. So I had to understand what was really a fight and what was a different.
Pick your battles. And
I had to pick it. And I had to go into battle, but I had to figure out what battle how I was going, my strategy. Yeah. And what I did was I said, okay, because there was so much pushback. I said, okay, we had grant money at the time. I said, well, I'm going to take the grant money I have and you will no longer get reimbursed for him. I'm going to use that money to hire a provider that is representative of the community and that can connect with the community. That provider can come. I'll just have him sit in the clinic. I'll have him sit in one of the rooms. I'm fine with that. But I will hire a provider who, and this happened to be a provider who was gay, spoke the language of the community, and was very well trained and committed to working with the community. Transformation. You saw patients getting better immediately. And when I did that, because they didn't want the extra expense, they moved that provider out. So it's those kinds of things that I did that were very challenging for me at times, because I really, I didn't have a good reputation. My reputation as a Black woman preceded me. I was a bossy, moody, angry Black woman. And I kept saying, I'm not angry. Being confident or having an indignation about how healthcare should be delivered doesn't mean I'm angry. Right? But I had to be able to tolerate certain statements. I had to be able to have conversations. Like I had to be okay with people expressing how they felt, because that's the only way you get to change. And this is something that I think we all need to understand. Yes, we have biases. And it's really about not always shutting people down when they begin to express it. You have to give people the breath to say how they feel, and then give them the education to hopefully shift their mindset.
Yeah. I think too, when you talk about of people being open to express their biases, I think, again, like you said, it's about how you communicate those biases. Because again, that is kind of like you can express it, and however you're delivering it in that space and time, it could kind of just go in through one ear and out the other. And it won't be a learning moment. It'll just be two heads clashing and probably just really adding more fuel to the flame between any disconnect or miscommunication that's already existing. So I think there definitely has to come a level of respect in the culture within any institution for people to, when you're in those team meetings, when you're in your staff meetings, people really having organic conversations and being truthful about what they're feeling, how this made them felt. And I think too, you kind of get that label of maybe being a whistleblower, or you're combative, or it's always something, you kind of, and so I think, yes, I think that is another task as a leader, and being in those positions, to have someone who can, navigate that and give people, the staff, the comfortability of being expressive and saying, hey, I want to have your feedback. This is a two-way, conversation that we need to have about everyone being on the same page to get that outcome.
Right.
And so, yeah, that's a lot of work.
Correct. And it's really important. I think what you said is just so vital. And if anyone had watched or read, his name has escaped me, the baseball player, Jackie Robinson. If you ever watch this story, one of the key elements, and this is what I'm talking about when you want to be on the cusp of transformation, whether you be whatever you be, whether you white, black, brown, it doesn't matter. But if you really want to be on the change, one of the key things that his coach said to him when he recruited him, he said, I want to change baseball. I want to integrate. But I need the person who will not react. I need the person who has the capacity, not that they are not that they don't want to fight. They want to be angry. They want to throw. Yes, you want to punch, you want to hit, you want to do all these things, and rightfully so, because as a human being, no one has the right to hurt, curse, spit, none of that, but has the understanding to not react to it, right? To defer it because you are achieving a greater outcome. So with healthcare, I use that because if you stick to the point that whoever is in healthcare came to healthcare, right, based on their mission, their protocol, and based on their oath to their profession. So you're a doctor, you're a nurse. The idea is if you stay focused on what you came to the profession to be, what you committed and honored yourself to do for the patient, and the patient is blank, doesn't have a color. If that is your goal, you won't get lost. And that is how you have to keep resetting yourself, is stick to what you're here. As a doctor, you come to save, help, improve. So whoever is sitting in front of you to that end, that's what you do. And you figure out how to do that strategy, because at the end of the day, you are, not doing harm to anyone. You are fulfilling the oath that you took to your profession. Nurse, even in security, the idea is that you are to de-escalate, not incite, right? It doesn't matter what you are in. It really is about, even with police officers, it's about keeping order, de-escalating, protecting. Those are the key mantras. It's not really about inciting and, all these different things that we get into. But like I said, it's a responsibility of everyone. And if we just stay focused to what we are committed to and what we have trained to and dedicate our lives to, and just not lose sight of that, we'll be able to accomplish what we want to accomplish, and understand that people really will remember how you make them feel. Period. They will remember how you make them feel. So when it comes to equity, yes, there's a greater reach, particularly if you work in areas where it's a safety net hospital or clinic. It's just so you just have to ask more questions, more in-depth questions, because the assumption is that poverty negatively affects folks.
Yeah.
Right?
The statistics and the social determinants of it, socioeconomic status, really, has a huge impact on your behavior. So they statistically say up to 40%.
Yes.
It really dictates what you do, what you eat, and it. And so I think, the mental health piece and really tying it in for young people, we can really change the course of those outcomes if we, again, come in at a good time. Because I think too, and you can tell me, have you serviced more adults than youth, or what was really your age group?
Interestingly enough, I serviced more youth when I was earlier in my career, and because I work with foster care, so I had nothing but youth. And what I learned about mental health in youth is, yes, talk therapy is really great, and having discussions with them, but art therapy is really good. It's the way you deliver the service. I did music. I also use television. I will use TV shows they use today and talk to them about what they see, because sometimes they can't articulate what's going on inside of them, but they can sure articulate what they see on television, right? And they can talk about what it means, what's going on, and what do you think is happening here, and how they feel about that. And that is what I use to help, them to articulate how they're feeling. I had a young adult woman, when I mean like she's like 23, and she was really afraid about getting into this like bout of depression again. There was a period of time where she like shut down and she could not figure out like what happened. Today she was doing fine, and she, and her primary care provider had had recommended that she go therapy, and she was like, I'm okay. There was a period I talked about what happened before, and I guess he feels like maybe I need to go back. So we really explored it, about where, and there was some still underlying concerns that she had, some underlying depressive mood. And we only had 5 sessions, but they were really monumental sessions that moved her to the next step, because what she walked away was with strategies. And that's what's key for young adults, is giving them strategies. They just need the ability to think through a process. If they can figure out how to think through it, and they'll figure out that there's other ways. And if they can move outside of themselves and not be impacted by the way people think, the expectations of adults, like if they can navigate it in a healthy and positive way, you've equipped them with skills. So in this particular case, she couldn't, she said, I don't know what my mood was. I can't remember. Like, I don't remember. I just know it was really heavy. It was really dark. And I asked her the question, what music were you listening to? And she went, and she talked about the music that she was listening to, and we pulled the lyrics.
Yeah.
And she was able to remember. Now, it's done with some kind of, you have to discern whether or not you are re-traumatizing, causing harm. So it was really about looking at where she was so that she could identify where, right, she lost the ability in her mind to cope effectively. Like what happened, like what actually triggered, where were the triggers, so that she can identify them today. So when she goes forward in life, as she is moving forward in life, when she begins to feel those triggers, or she has a trigger, she then knows how to get self-care, get help, get support in that moment before it progresses to that darker place for her.
Yeah.
So that's what really happened. Yeah. And it was transformative. But yes, young adults really need you to connect. They need to be validated.
So meet where they're at. And that's
you really want to validate them. So, it sometimes, solution focused therapy works, and sometimes dialectical therapy works, because it's really about validating where they're at, and then helping them to find different ways to cope that more beneficial and that are healthier for them. And sometimes them understanding that sometimes they don't recognize that there's a healthier option. They can't appreciate it yet, because it's reinforced within their community, and really being able to develop those inner strengths so that they can sometimes be different than the folks that they're around. Like they may have to change their social networks, and that can be very difficult for a young person. So it's really about, how do I do that? How do I begin navigating through that? How do I build a new network while I'm still in this network? And how do I, not let certain things, and how do I not, succumb to certain pressures that, or expectations that people have of me? How do I withstand that? How do I set boundaries? How do I say no and feel confident and comfortable in doing that? And sometimes it's really about just looking at, if you say yes, then what's the next step? What do you think will happen? And really working through that. And it's many different ways, but it's really about equipping them and designing it, not in the, in a non-traditional way. You have to be adapted to who they are, because everyone is individual. Everyone's an individual. And it's really important to listen very critically, do really good intakes, and listen very critically to what their presenting problem is, and what is it that they really want to change and achieve. Yeah. Right. Mm-hmm. And designing and picking the therapy strategy that works best for them, that you believe works best for them as a clinician, and do an adaptation or change if that isn't working, and being really keen about it, really paying attention to, because with young adults, young teens, you really want to look at evidence. You really want to make sure that they are progressing, right? And they are transforming, and they like to graduate. Give them something to work towards. You can have greater coping skills in 5 to 6 to 10 sessions, right? This is not ongoing. And you get to talk about strategies that help you, right? And find out, all these things that you're doing really working for you, right? And it's really about them, because sometimes we value what other people value. Like we have value in what someone else values. It's not really our value though. And that's very tricky, because sometimes when you break it down, you're like, okay, what is it that I really, really value? And it's because I value how my friend feels about this more than I value how I feel about it, because I value the friendship. And not to disturb the friendship, I will negate what is important to me so that I keep the friendship. Right. So it's that kind of thing with young adults. And not really calling it, mental illness, moving those words, right? It's counseling. Like I use more terms like counseling, strategy. This is an opportunity to develop.
Those are like all the stigmatizing words. Just
remove them. Just
let's call it something.
It triggers anxiety. It triggers folks to shut down when they hear these words. That's why I said mental health is really about, it's everything that you do. It's about your health. And I really define that, and I ask questions of young adults. What do you think about mental health? How do you feel? What have you heard about it? Like I do a lot of exploration first so that I can deconstruct those concepts and beliefs in their thinking so that they're not barriers to our work.
Yeah. And I think, I was on a previous show with William Hanabu. I was talking about my exposure as a child. Like, what did I think about mental health? And it was so extreme, right? It's like I said, the straitjacket with the syringe and the sterile environment, or it's like the serial killer who's, a psychopath. Like it's so, it's so negative. Or, you just think about the most heinous things, right? When you think about mental health, for me, and just like scary movies. And a lot of that, I just said it subconsciously, gives us that perspective, as being young and impressionable, and what we're like exposed to. And then again, not having education on mental health, like really understanding what that means and what it looks like, and how it's so vital to every person. So, that definitely for young people, like what you entertain and like even what you're listening to. See, those are like the other peeling back those layers of what you're feeding your brain and how is it really affecting your behavior. Because if you're looking at, things that aren't, we would say counterproductive or negative, it could resonate if that's what you're constantly visualizing, constantly feeding yourself. So I think those are other ways to be more interactive with young people, meet them where they are and say, hey, why don't you maybe watch this or change it? This will probably help you think better about this, topic or area. And I think those are the things that kind of will, again, eliminate that barrier and have them more trust. Because I think with providers, especially, being of color, I think there's an implicit bias that kind of goes away when you are in front of someone of your hue and of your background and you read their bio and they're from the community and they're like, wow, this person I already relate to before I even get in the door. Then you obviously foster that relationship. But I think that is like so key with the, art therapy, using music. Those are all forms of expression that are important. And you could really learn a lot about how people are feeling and, like how you identify. There's like, we all, in this society now, everyone's in their bubble with their headphones, right? You kind of going through your days, like your playlist is your soundtrack for your life kind of now, right? Like how you feeling is kind of like what you play sometimes. So I think too, those are good ways to get, the client talking, get them comfortable and learning about what, they're suppressing or what they could have been feeling at that time with lyrics and everything. Yeah.
And it works in reverse as well, because I ask folks, like, what's the song that gets them going? Like, what's the song that, gets them out of bed, that, when they're going through a hard time, what do they listen to lift their mood?
Right.
If they listen to music, like I'll ask those kind of questions. And it tells me about where they're at based on the lyrics or based on the rhythm or the beat.
Yeah.
Right. Sometimes the hard beat or the softness of it tells, this is just where they need to be in the moment. Right. This is what settles them. This is what calms them.
Yeah.
Right. And this is where they connect. If they have a four-legged baby, if they have pets and what the pet means and how they connect with their pet, right? All these things matter. And this is all about really about the mental, how the mind works, and with youth and young adults, they're very feeling oriented. So when you're talking about the mind, there are really three parts to the mind. I mean, you have beliefs, you have cognition, and you have values. That's all in the mind. But you have the feeling mind, you have the thoughtful mind, which can be very rigid and black and white. You have the feeling mind, which is all over the place. And then you have the wise mind that's supposed to balance between the two. So with children, it's really about increasing the strength of the wise mind, where they can balance things better. I know I feel this way. I know this is making me crazy, but let me really think about it a little bit more. Or let me take a moment before I really react, or let me speak to someone about it, right? Because the feelings are so visceral, I want to react, or I want to feel, or I can't get out of it, or it makes me feel hopeless, right? So it's really about restoring hope.
Yeah.
And helping folks understand that there are nothing, the one thing that COVID did, and COVID was devastating. It was horrible. It was, oh my God. It was such an incredible challenge for the people, for those who lost people, who suffered, my condolences. I know today you're still healing and still reeling from that. But the one thing that I said that COVID did is that it really dispelled this notion of certainty, right? So it helped us to understand that this whole idea of control is an illusion, right? What we do is we affect change, but we don't really control things, outcomes, but we greatly affect it. So if we get up in the morning and we get to work, we'll, most likely we'll get a paycheck until, God forbid, something happens to us and we can no longer earn. So we don't necessarily control everything, but we greatly can influence and affect it, both positively and negatively, right? We had to adjust. It shows, with all the hurt and heartache that COVID brought, it also demonstrated and showed the disparity among people of color, right? But it also demonstrated how resilient we can be, right? If you think about it, if you think about today, unless you were someone who lost someone close to you, 2 years ago, it's hard to get back to that's where we were. Like we were inside. You see people out, they're connected, there's no mask, people are having a good time. It would be hard if someone came in that never knew what happened, would understand just 2 years ago, no one was on the streets. Everyone was at home.
Yeah.
Right. And people were suffering. People couldn't go to funerals. People were
giving birth by themselves. Women were,
it was hard. People were just leaving this life by themselves and couldn't reach, in different states, well checks and finding people have expired. It was, and where I live near a hospital, and the trauma that I felt was, I feared for my own safety. And I started to think about, I didn't think I was any different from anyone else. And I said, okay, it really helped me to rethink my spiritual beliefs. It really helped me to realign my life. Like, what do I need to set up for my daughter? Are things in place? There are things that just made me think about that I didn't think about readily, right? But I would hear the ambulance. And I'm telling you, I would hear the ambulance every 5-10 minutes. And I would just I would have to keep breathing through it, because I was like, my God, I pray that person gets to where they got to get. I pray that they get the intervention that they need. I pray, because you knew it was just related to COVID. And then where I lived in proximity to the hospital, so I would hear the freezer. I would hear, it regenerate. And every time I would hear it, I would know that there were people, there were loved ones. And it was, you're talking about just constantly feeling the weight of it. And then there were people that I lost that were close to me. And I cried a lot from watching people I didn't know. I was watching the internet and I cried a lot. Like people's stories, I would just, and to the point where I was like, I have to turn off, because that's another strategy. Sometimes you just have to turn stuff off, because I would just be really empathetic. I would just have this great sense of empathy with people. And I would just go, oh my God, this is just so horrible. But the resilience of people, and this is the thing that I want folks to understand, the resilience of people is still incredible, the way that we're made. And that what we learned is that the community matters, and coming together in a healing way and supporting each other with love, understanding, and support, because it leveled the playing field in one way, not completely, because people of color, were dying at 40%, 43% higher than anyone else. So we were hit far harder than any other race or group. But and even in that, coming together, the community was able to support each other and to pull together in many different ways, which demonstrates that, yes, there are ways to develop coping skills even in the most challenging situations. And there's ways to continue to heal. There'll be people who will be healing from now, going through the grief cycle from now until they transition. Right. Because losing someone is never, ever easy, and everyone heals at a different space. Especially today, there's a lot of children that are really suffering from loss of loved ones. And we just have to recognize that mental health is in the fabric of everything that we do, it's every word we speak, it's every glance we have at each other, it's every touch. Right. And it really is incumbent upon each of us to make a decision to just operate at the highest level of who we can be and get the help to do so. Right. During this period of time, mental health is not easy when you're conditioned. And, I never make light of the fact that sometimes people of color are just conditioned to see things. And it really takes some unpacking to see things differently. But you want to be able to commit yourself at least to the time to unpack it, right? And I was so happy when I started working in 2020 in my independent practice, because I had young adults, I had women of color, but I also had men of color. And working with men of color was, to me, was such an incredible experience, because they don't want to talk about stuff and get help, and get the help that they need to feel better about where they're at and who they are. But I've had the privilege of just being entrusted with the lives of some incredible men, and working with them has been phenomenal work. And I recognize that if we just take the time to really provide that kind of work and service, especially clinicians of colors or non-clinician of colors, or recognize that you may or may not be equipped to do that, and honoring that. It's okay to honor that, right? It's okay to say, I'm not really good with this or that or this. And I learned that, and I taught that when I taught medical residents. I really challenged them to think about the community of patients they can be most effective with. And there was one provider who I taught who said, you know what, I cannot work with people of color. I'm going to work with my people. I cannot get past basically my biases. And I said, that's great. And people be like, I said, no, that's great. It's great that you're able to acknowledge that, see that, because that's what's key. Yeah. So now you can go out and be an effective and wonderful provider and treat the population that you feel most equipped to feel. Now, can that change somewhere down the line? Yeah. anything's possible, but at least the initial acknowledgement is very, very key, right?
Yeah. Yeah. Because him not recognizing that would have been at the expense of the patient and the practice. And
it was, yeah.
So yeah, you could only respect it and just say, wow, that's actually a bold thing to do, is to just say, no, this wouldn't be a great fit.
Right. But it took the right provider in this particular case and me working with them to be able to create an atmosphere where they could say it. Mind you, they're talking to a person of color.
Right.
And, I had to set it up where I said, it's okay. I am not going to be offended. You can say whatever you need to say, because what's important is that you become an effective provider. That's my goal. My goal is not to do anything else, but to help you to be an effective provider. So to that end, you have to be able to speak honestly from where you're at, truthfully. Yeah. I had a group of providers, brown providers, who said, we think Black people, we don't like working with Black people because we think they're all angry. And I said, say more.
Right.
And they said, no, I said, say more. How did you arrive at that conclusion? What happened? Like, what were your experiences that validate that conclusion for you? Because clearly this is the place you operate from. So, and they talked about it and they said, well, they're always loud, or they're this. And we talked about the ability for people of color to express themselves. We talked about education. We talked about poverty, how that limits. We talked about what they may be expecting, what they may feel you think about them, the internalization of racism and what they've experienced in colorism. And it helped them to go, oh, they're not always angry. So it was at the end, I was like, no, people aren't always angry. People can be indignant. They feel it. You may not think you're communicating a bias, but you are. You may think you're just saying what's wrong with you. The moment you tell a patient, calm down, you may be inciting them, because you're accusing them of being angry or excited when they're just feeling emotional or indignant about a feeling of injustice.
Right.
And you really want to have a greater tolerance. You want to expand your wall of tolerance so that you can tolerate a patient sounding more aggressive, but that doesn't mean that they actually are being aggressive. Yeah. And that was really in working with doctors, helping them to do, right, is to be able to expand their wall of tolerance so that they were more objective in working with patients. And especially if they ask the patient to use drugs or anything else like that.
Right. Yeah, what we do, you gotta, and it's like when you talk about this, you can't, brush under the rug, the racism, or it's kind of like put that, that is, I think, a motivating factor. It's a big motivating factor. And, when we talk about mental health, when we talk about history and we talk about what percentage, it's not like a concrete fact, but genetics, your environment, all, that plays a role, and who you are molded and a lot of the choices that you make.
Right.
And then, again, the stereotypes too. If you look a certain way, if you dress a certain way, if you talk a certain slang, they're already assumed uneducated, aggressive. And that again puts a fear in that person who's, trying to service you. And so you're right. I think there is a problem with that. But right, you said it has to kind of start with a conversation and educating, just because someone has a little bit of an attitude, and I wouldn't say attitude, or just a more boisterous personality. I mean, however we would categorize that, when you said that notion of telling someone to calm down, right? Like, it's like, understanding, where that could, what that personality, means to you, or like, how do you react to someone, that has that air about them in your office? And how could you still service them, and that, again, tolerance. But I think, it still comes down to, again, respect and learning respecting our differences. And I think we still have a long way, we have some work to do. I see that things are improving. But when we're talking about just, I think the Black community, we have to treat each other better. You know, I think there's still issues amongst ourselves, and we battle, you know, self-love too. I think that is like the first step, right? Is loving yourself, and being good to yourself.
Right.
And so I think, yeah, there's a lot of layers to it, but it really starts with, I think, therapy and Black people being open. And I think we also have to talk about too, like being brown and being Black, being Caribbean. There's so many, we're so colorful.
Yes.
And, you know, I think too, that is another just a tag. You're Black. Well, I'm brown. You know, my skin tone is dark, but this is where I'm from. And, you know, learning about an individual. I think we all have stories, we all have experience that kind of, you know, form our belief system, you know, and I think the most important thing too is feeling empowered, feeling like you have a voice, and feeling like you really have a shot. I think, again, that hopelessness where you kind of feel like society already writes you off, that's where that anger and that, you know, rage kind of fosters and grows as you go through life, and you're not, you know, feeling like you're worth anything, or again, like the foster care, young people who age out and there's really nothing available to them to meet their needs and the things that they go through, and they're most likely to experience homelessness or substance abuse. So I think as a community, we definitely have to do better to provide services for those who would need it the most in those cases. But I think, yeah, we have some work to do with mental health care and stigma, and giving back to the community and providing more services.
Yes.
Because it definitely affects everyone. And just like, you know, I always have to talk about, you know, violence. Those are the measurable things that we can decrease. We can decrease gunshot wounds to hospitals. We can decrease the cost of healthcare.
Yes.
With people making positive health choices and eating better at a young age. And then you say, wow, the obesity rate from 25 to 35 went down, you know, 16% in the last 5 years, because yes, these services are in the community, and we have people now, you know, choosing better healthy choices. And it's, you know, it's a shame that, you know, right now there isn't, you know, services that are accessibly and, you know, in the community, that are walkable and local as well.
There aren't enough. Yeah. They're not enough services. And even if there are, they don't last long enough because things cost money. Yeah. And one of the key things that you touched upon was just about, you know, really talking about the violence and the anger and the frustration and folks being, you know, boisterous and things of that nature.
That's what everyone sees on the news, right? Like when you watch, I watch New York One, and I'm like, wow, okay, out of the whole hour, half of it was about, you know, the shooting in Brooklyn and that person being a Black male. Then the shootings of town, those are young, you know, people, males of color. And it's like, that is what the world is seeing. That is it. That's the label.
Well, that's the narrative that's put out there.
The narrative that's, you know.
And we are the mind is easily conditioned. I really think that we don't validate enough. You know, the mind can be conditioned. So if you constantly are putting out that content, you will be conditioned just to see it that way. But, you know, the undercurrent of all this anger and that people experience is pain.
Yes.
You know, and hopelessness. And that's why I said, if people took the time to be even slightly more patient, understanding, assume the best, stay neutral, deferred for a moment before they drew a conclusion, you may get to the pain point. And at the pain point, there's the opportunity to really do some meaningful work. And you will find the opportunity. People want to be humble. People want, because there's power in humility. People want to be able, they just don't think they'll be heard, right? They don't want to be vulnerable. They're already being stepped on. Why be more vulnerable, right? Yeah. So it's really about how do you know, not you want to keep people's dignity in place, right? So if you strip people of their dignity by being condescending, by being dismissive, you're going to cause pain. And the pain will be covered in anger, indignation, shutting down, being dismissive. But it's really important that folks understand, particularly people in positions of power like doctors, nurses, teachers, that you have a responsibility to be mindful about how you communicate. Because when you are communicating, if you communicate in those manners, you can do harm.
Yeah.
And then you want to project that it's onto the patient or displaced and say, no, it's the patient who is not reacting positively. And it's really having some awareness, but everything, everything goes so fast. We really aren't spending time, especially with social media, we really aren't spending the time that's necessary to really identify these things. It doesn't take as much time as people think it is, but you have to slow down the interaction. You have to slow down the response. You have to take the opportunity to take 3 to 4 seconds to think rather than just reacting, right? Or just making an assumption that the person in front of you is like everybody else or like who I've defined them to be. That's not fair. And you're not doing a good service to your profession when you do that, whoever you are. If you sit in that seat of authority over someone's lives, that you're responsible for treating, teaching, helping, supporting, and growing.
Yeah. Yep. And I think it's, again, for young people specifically, is to get that continuum of like positive reinforcement. And, it does start in your home. It starts in your school and your early education, and then the community. And like, again, the environment, a lot of, we say things too that are really impactful in the words that we say and how we say it too. It's like, I'm a product of my environment. Like, that's the thing that we say. Absolutely. And it's kind of like, well, what is that? So please tell me what product, like, what is your product? If you go read the back of a car, and what product are you? What percentage of this, made you who you are? So I think that definitely we should have more positive connotations when we say that. Right. When we talk about being triumphant over the negative, right, that we experience, and say, well, I'm a product of my environment, but I achieved this, I went through this, but I took on this opportunity, and I went to school, and I studied, and I made better choices than some of my other peers, and being open and being proud about it.
Correct. And it's different than saying, I'm a product of my environment, rather than saying my environment was a factor in the way that I think sometimes, in the way that I operate, in the way that I move, right? My environment influenced the way that I think, my trust levels, the way I cope. That's what my environment did, right? It's not, and it removes the negative connotation of that I'm a product of what, but I'm influenced, right? And I'm influenced both in my subconscious way, maybe deep in my neurons, it just, and I don't understand that that I'm operating out of some kind of experience that I had long ago that I'm detached from consciously and don't know, but this is where it comes from, right? I've developed some fear, or I'm honoring something that I need to stick to, right? And sometimes it's as simple as that. And it's really, the process of what I call in my process of tunneling backwards is really about trying to get to, where did you first hear this, right? Where did you first experience this? Because that sometimes is where the distortion comes from. And the longer we wait to get help, this is very key. This is why it's very good when young children and young adults get intervention early on. It is super fantastic when they do that, because the longer you wait, the more you have to unpack. And sometimes it's more difficult to get to the root of where your fears are, where your challenges lie. And I could say that personally, right? And when I meant to say earlier that conditioning, the conditioning about mental health exists for even clinicians, because it did for me.
Mm-hmm.
I delivered the service, but when it came to, sorry, I just have to have some water.
Yes.
But when it came to me going to therapy, we it's recommended in our profession that we get therapeutic intervention. And I did.
Yeah.
But as I went along and had challenges in life, with marriage and having a child and, just trying to keep the balls juggling, right? I could have absolutely benefited from going into therapy. But in my mindset, I thought, because I delivered the service, that meant something was wrong. Like, and it was so incredibly wrong the way that I thought. But it was part of it was that, and this is how I kept explaining it, was to myself, at least, saying, well, I should be able to handle these things because I know the strategy. Like, why isn't the strategy working though? And I had to get to a point where I said, you are asking people to trust you with their lives. You need to show up 100% plus. And the only way you can do that, if you're clear and that you get your kind of help for you, and that you do some self-care for you. And I got into therapy.
Yeah.
And it has been incredible. And it's not that I don't go there knowing I might have a sensibility about it, but my therapist is able to pick up, but this is how you do, this is what you expect. This is how you show up. This is what and I'm like, you know what? I didn't see it.
Yeah.
I'm like, you're right. That's what I do. Because, everyone has, when I talked about the values, the 5 core values, sometimes those values can, what I call honor locks, like they can be the thing that you are committed to it no matter what. Right. And it could cause you harm. It can cause you pain, but you still stay committed to it because there's something about it that means something greater to you than the stress that it causes you. I'll give you a better example. I had a client who, children, this is very important for parents to hear. A mother married 16 years, was in an abusive relationship with her spouse. She believed that as long as the spouse just abused her, she would tolerate it because it was important for her to keep the family together. She wanted the children to have their father because that was important as a woman of color, and not having a father who lived outside the home, did not want to be a statistic, right? So after 16 years, the father strikes one of the children. Game's over.
Yeah.
The mother leaves, takes the children. She even files charges. In the deposition, she learns from reading the court documents that her kids have been traumatized for years.
Of course. She
didn't know. She was blind to it. She didn't understand that they were still suffering, though they were not being directly, it was that vicarious trauma, directly impacted. So when that happened, though, she had a lot of remorse and grief. Oh my goodness. She was so that it started to have physiological impact. She was hyperventilating. She was stopping in the middle of the street. She couldn't sleep. She was just not doing well. Right. And she wanted to get into therapy. I wasn't taking clients at the time, but she was in such distress that I said, I will take you for 2 sessions, what I call a bridge process until the opening comes up with your insurance. Opening comes up in a mental health clinic. So we did 2 sessions, right? And in those sessions, I just wanted to relieve the depression and the heightened anxiety. I just wanted to ease it. So if she was at a 12, I just wanted to bring it down to like an 8. Like, let me see if I can do. And she kept asking the question, why, I don't know why I let this happen, why I let this happen. So I realized that she's not going to move from that until she answers it for herself.
Right.
So we did some work, I started doing some exploration. So I learned that, her mother and her family and everyone were not in two parent homes. They were in single parent homes. So she felt really good about that. Right. So she felt like she was above the margin by being in this two family home. So breaking it meant that she was unsuccessful. Right.
Yeah.
Right. So she also, her mother was the kind of person who negatively spoke to her about, like, there's some failing, you're failing, why this isn't working. It's you, it's not working. You're not doing this ABC right. Why he's dissatisfied and why he decided to, physically, emotionally abuse you. So she internalized that and believed that she was in fact the problem. So we had to unpack that. But one of the key things is she was still questioning, I don't know why I put my kids in this and what happened. So I finally asked her a question. This is when I use other mediums. I said, well, did you ever watch What's Love Got to Do with It? She said, yes, I watched it like 10 times. I said, okay. So why did she leave? And she said, because she finally got, tired of it. And I said, no. Well, she finally started doing, the Buddhism work, and it gave her, I said, no. I said, no. The question was, I said, why did she stay? And she said, well, she loved him. She did this and she wanted to do this, the kids. Oh, she just went through a whole list of things. And I said, no, that's not why she stayed. And she said, I watched the movie 10 times. You may got to watch it again. Mm-hmm. Like, she just was like, what do you mean? Mm-hmm. I'm telling you that she loved him. She supported him and everything. I said, why did she stay? There's a reason. She said it. And she said, I don't know. I said, if you go back to her history, right? When she was sitting with her friend who was teaching her about how to pull her inner strength, mm-hmm. right? And learn Buddhism, she said, I know what it is to have your family walk out on you. And I promised him I would never do it. Mm-hmm. And she sat back and she said, oh my God. I said, you stayed in your situation because you promised yourself that you would keep your children's father together. You wanted your children to have this nuclear family. Mm-hmm. You promised yourself this. You promised, you were committed to this. And you honored that promise. You honored that union. You honored having that nuclear family to the point where you tolerated or was able to tolerate the abuse. But there was something greater than that. Mm-hmm. Was when he struck your daughter. That's it. That's what broke that honor lock for you. And you were able to move. Mm-hmm. From that conversation, the anxiety, the overwhelming anxiety stopped. Mm-hmm. She still needed to go on and do work, but that weekend she was able to go get her nails done with her daughter. She was able to go shopping. These are things she couldn't do. Mm-hmm. And that's why I said sometimes it's just that sudden. If you can get to the core of what it is that's causing you the pain, that's causing you the confusion, and shift it, that's the relief you need. That opens you up to go, all right, now I can develop the coping strategy and I can begin some healing, some self-compassion and forgiving myself and forgiving myself for, putting my kids in harm's way and for causing them trauma, but understanding that the same kind of psychoeducation, the same kind of information, the same kind of work can help my kids to develop the strategies to deal with. This is not something that they have to be burdened with. Mm-hmm. But for years to come, that it won't cause them distress. Yes, they'll remember it. Yes, they may or may not remember it. I'll take that back. But it doesn't have to cause them stress if they're able to work through what it meant to them, right, and how they can figure out how to put it somewhere. Mm-hmm. Right?
Yeah, I think that is so important when you talk about households and the structure and what's learned and what's, what young people are exposed to, because you sometimes it can be normalizing where, yes, my mom, you hear it all the time. Well, my mom was abused, so I got what you just see the cycle of it the daughter gets with the man who abuses her,
Absolutely.
or even vice versa. Sometimes when males don't have males in the household, and a mom is raising their son, and it's hard for a mother to raise a man, and they're not getting the tools to like properly transition into manhood, and they're disrespecting women, or they have other negative, perspectives and how they treat women of the opposite sex. And you're kind of like, well, let's kind of look at the story here and what they were exposed to. And a lot of times that is the case when it comes down to your household makeup and, things that have gone on. And then what you believe too.
Right.
And so, yes, I think that is something that, across cultures, and every culture has their thing too. And even when you talk about spirituality and religion, there's things that you're taught and it's like embedded in the fabric of culture that sometimes you do have to work through and be like, well, this is really not healthy for me, even though my culture and my religion, may say otherwise.
Absolutely.
And so I think that's a lot, that's heavy stuff to work through with clients as well, or just people navigating what's best for them and their families or whatever situation they really find themselves in.
Right.
So yes, I mean, I think we are on over our time, but this was such a great conversation. I think we really touched on just our solutions a little bit, what health equity means to us, and just having a heartfelt conversation about the times we're in, what we can do to be better for ourselves and each other. So I just thank you for coming on, and you've done the work. You are a great professional, and thank you so much for all that you do. And I'm here just getting in the game in a way, and really wanting to speak with professionals. I really approach this from a lot of my personal experience, and what I were afforded growing up, and opportunities that presented itself through social programs.
Yes.
And speaking with professionals like yourself and other doctors really give me the tools and the insight and how to take my experience and just like my more of a business mind, infuse it to really try to break some of the things that are fix some of the things that are broken and offer positive solutions. So just thank you for your time tonight.
Yes. And I just want to say, imagine if everyone took your approach. Like if more people, you are so needed. You're phenomenal. What you have endeavored to do is absolutely what's needed. It's authentic. It comes from your heart. That's why it's going to be phenomenal. And anything that's worth doing sometimes takes time to grow. And don't get discouraged. Yes. Don't lose hope. Don't anything. Just decide that, this is going to work. However it's going to work, we're going to get it. We're going to get it done. We're going to find the funding. We're going to do it.
Yes.
And I love the name Renaissance Center Mastery. I mean, I looked you up and I'm like, this is on the brink of where we need to be. And you are going and are currently and will continue to be an inspiration to young adults, and just deciding I'm going to strike out and do what I need to do. Back in my time when I was your age, we kind of did it one way. We weren't as entrepreneurial, back then. But today I'm so amazed and so encouraged just by folks saying it's time. I'm going to strike out and figure out how to get this done. And bring others along with me. And you always have an audience. You will always never, ever believe, never be discouraged by that. So thank you. Thank you for the opportunity. I'm humble.
Me too. I love pouring into just, again, sharing a positive space, pouring into each other. And I think that is like so important, and just uplifting each other and just kind of like rising above all this, turmoil and everything that has happened in the last 2 years. And it's really just about coming together and making positive change and really believing it and being empathetic and, coming in with just ideas, innovation, and that high performance, we got this kind of attitude as well. I think it's all encompassing. So again, thank you, Gina.
You're welcome.
Black USA News and myself, Corinthia, happy to have had this conversation tonight. And I hope everyone took something, learned something, and felt good about participating and hearing what we wanted to discuss today. And the conversation will continue. Okay. Absolutely. So thank you all. Yeah, all have a good night.
Good night.
All right. Bye-bye.